Thank you, gentlemen, and thank you for this session that we're having in June. Just to say the Over 50s Black Men Forum is supported by the National Lottery Community Fund. I now hand over to Dr. Adetun G. I believe you're on mute.
Yes, good afternoon, gentlemen. Today we'll be talking about renal medicine, and it's a very important topic, and we need to look after our kidneys for healthy living as well as longevity of life. Now, when we talk about the kidneys, what exactly do we mean? They are the bean-shaped structure that you got just below your ribs, mainly at the back there. So, and then I will give you the definitions of the kidney, chronic kidney disease, which is defined as reductions in the kidney functions or structural damage or both present for more than 3 months with associated health implications. Kidney damage may cause fluid and electrolyte imbalance and leakage of protein and or blood into the urine, resulting in proteinuria and ammonuria or hematuria, as it were. Next slide, please. Now, when you look at the kidneys, like I've said, it's a bean-shaped structure, and you look at those brown bean, kidney-shaped beans. If you know kidney beans, that's exactly like that. So the kidney looks just like that, and it's located just below your ribs at the back there. What does your kidney do? What does my kidney do? It does regulate ions in the blood. That's your salt, your potassium, your calcium, and phosphate. All these ions are regulated by your kidneys. It regulates your blood volume, which adjusts the volume of blood or eliminating the urine, and also regulates your blood acidity, the blood pH. So regulate by excrete a variable amount of hydrogen ions in the urine and conserve bicarbonate to balance your acid base in the blood system. It also produces some hormones, which maintains calcium in the body, calcitrol, as well as erythropoietin, which actually produces red blood cells. So when you suffer from chronic kidney disease, one of the health implications is that you may develop anemia moving forward. And then the last bit of the functions involves excretions of waste. And you know that when you store waste in the body, the resultant effect could be quite catastrophic. We shall discuss more about that moving forward. Now, ammonia and urea are excreted via ammonia acid, creatinine by creatine phosphate, as well as a lot of drugs that we do take ends up being excreted by the kidneys. When you look at the right side of your of the screen there, you look at those structures in there. Those are your two kidneys. You could function with just one kidney, but each individual has two kidneys normally. But there are some people that have just one kidney, yet they function pretty well. So donating kidneys shouldn't be a problem, and it's one of the things that we should encourage. So you don't have to have two kidneys to live a healthy life or a functional life. So you can donate one of your kidneys if there's a need for it. So the kidneys, there are two of them on the right and the left, and they're connected by your pipe, which you call the ureter, which carries your urine into your urine bag in there, which you call bladder. And from there, the bladder links up with the urethra, which is the pipe that actually takes urine from your bladder out via the penile shaft. And along that pathway, a lot of things will happen in the kidneys, in the ureter, in the bladder. The bladder is actually at the neck there, has the prostate in there. We've talked about the prostate in the past. So anything along that pathway can actually affect the kidney functions. Next slide, please. Next, okay. Now, these are facts and figures about chronic kidney disease. 10% of the world population is affected by chronic kidney disease. So around 3 million people in the UK alone have CKD, chronic kidney disease. Millions die yearly due to poor access to avoidable treatment. And what are the treatments that are life-saving? We're talking about dialysis as well as kidney transplants. Prevalence rates. Russia has the highest rate so far, as about 12,132 per 100,000 populations. Look at Mexico, look at South Africa. There you had Nigeria in there with 11,387 per 100,000 population. So it's quite a significant amount. And look at South Africa also, look at Mexico. Now, coming down to where we are, UK here, it's quite staggering too, but you can't compare it to, Nigeria, Africa that we're talking about. So you have about 5,167 per 100,000 population there. What are those risk factors? Next slide, please. Now, the risk factors: diabetes and obesity with metabolic syndrome, high blood pressure and heart diseases, family history of kidney disease, heart disease, diabetes, and hypertension. Age 60 and above. I know we are not yet 60 or but we still need to look after our kidneys. I haven't talked about diabetes as a risk factor, high blood pressure as a risk factor. I'm not sure how many of us actually check our blood pressure regularly. That's very, very important to be able to protect your kidneys. Low birth weight in children, then chronic recurrent UTI or obstructive uropathy. Here we're talking about enlarged prostate that is causing an obstruction to the flow of your urine. And so when there's a backflow of urine, that will actually damage your kidneys and could cause chronic kidney disease. Neurogenic bladder, when your bladder doesn't empty the way it should empty because of some malfunction of the nerves in there, it could retain a lot of urine, and there's what we call a backflow. So when there's a backflow, that will also damage the kidneys. There are some kidney genetic problems like polycystic kidney disease and gout. Sorry about that mistake in there, which can cause some problems in there. There are autoimmune diseases like lupus, vasculitis, and other myeloma multisystem disease, which have potential kidney involvement and they could damage the kidneys. Abuse of anti-inflammatory, ibuprofen, aspirin, diclofenac, indomethacin, and all those drugs there can be very damaging to your kidneys. And there are other drugs equally that are called nephrotoxic drugs. We need to be aware and avoid such. Then poor access to health facilities, which is very common amongst some of us, in Africa and other areas, even here, where people don't, see their doctors regularly. That will actually cause a lot of problems. Then ethnicity. Yeah, we come in strongly here. Black Africans, Hispanics, American Indians, they have been known to have very significant prone to kidney diseases. Next slide, please. Now, what are those signs and symptoms? These are not rocket science, and you don't have to have all these for you to talk about chronic kidney disease. But generally, one could be very tired because we've talked about excretion of waste products, maintenance of homeostasis, production of blood in the kidneys, and maintenance of the body functioning system. When those are not working well, that will lead to fatigue and tiredness. You could start feeling very nauseous for no reason at all. There could be loss of sleep or poor sleep pattern. There could be shortness of breath when there's retention of fluid, whether in the lungs or in the body. Then you have poor appetite because you don't have functioning system properly. That could lead to low intake of food as well as poor appetite. Then you talk about weight loss due to malfunctioning of the kidneys. Itchy skin because of retained waste products in the system. That could cause a lot of itching, and that could be one of the factors or signs and symptoms that you see in kidney diseases. We talk about nocturia, waking up at night 4, 5, 6 times during the night to wee. That could be a sign which needs to be looked after. Erectile dysfunction. I know this is a major problem amongst men. So I'm not saying that kidney disease is the main thing in there, but if that's a problem, you might need to look at your kidneys, look at your prostate, look at your bladder just to check things out. When you notice blood in the urine, which we call hematuria, that's something that needs to be worried about, and you need to have a look at that through your doctors. Swollen ankles, feet and hands, as well as proteinuria, that is protein in the urine. You could have slight trace of protein in the urine, but it's not detectable. So when you start having detectable protein in your urine, which we call proteinuria under the medical terms, then you need to be worried. Next slide, please. Now, I want us to be very careful with this number here so that you don't get very panicky, because you could have a blood test and then they give you, oh, you got CKD2 because your eGFR is 79 or 85, and then you get very panicky. I want you to take very cognizance of what I'm going to say here. Now, these classifications normally is to do with using the eGFR, and that is how your kidney actually filter the waste products. Now, as you grow older, your kidney equally grows older, and that filtration factor or filtration, efficiency might start decreasing. And so they found that your eGFR is not 90 and above does not mean your kidney is completely failing or you've got problems. So, and that's why we need to actually take cognizance of what we're going to say in here. Now, chronic kidney function and disease is classified into 5 stages for now. Looking at the eGFR, which is how your kidneys actually filter the waste product. Now, when we look at the stage 1, normally your eGFR will be greater than 90, but you have a normal or increased GFR. Kidney stage 2, there is a kidney damage with mild decrease in eGFR, which is 60 to 89. So if you have an eGFR of 90 and above, that's nothing for you to worry about. Most people will not fall into that category. So now we start looking at things from stage 3, kidney damage with moderate decrease in eGFR between 30 to 59. And then stage 4 is eGFR 15 to 29. That's kidney damage with severe decrease in eGFR. When you get to stage 5, where you have the eGFR less than 15%, then here there will be a need for either dialysis or other factors, depending on what your age and other factors will be. Now, when you want to detect kidney disease in terms of investigations, what are the things that your doctors could do? You could do what we call a blood test to do your kidney function. We do all this yearly, and then that could detect your eGFR. And that is why I said we shouldn't be alarmed. So when you look at those numbers, you need to interpret the numbers in context of what your age as well as other values are. Not just looking at, oh, my eGFR is 80 now, and then you start panicking. No, you need to look at that in functions with other things within the blood parameters too. The urine test to detect proteinuria, which is protein in the urine. So there are numbers that we do use. I don't want to bog you down with that, but if you have significant amount of urine and protein in your urine, then the doctor will call for more investigation for yourself, or blood in the urine for whatever reason, so that needs to be investigated. Then we do other imaging too, like ultrasound, MRI, or CT, as the case may be, or CTKUB, looking for kidney stones, looking for tumors, looking for other conditions that may damage the kidneys. Next slide, please. Now, how do we manage kidney functions? Primarily, this is where you come in as an individual. Before you get to the level of CKD pathway, well, you need to look after yourself and your health. Good management of blood pressure, like I've said before. If I want to be a bit cheeky, I say, okay, if you have checked your blood pressure in the last 2 months, put up your hands. I know how many of us will be able to pass the test. So we need to actually monitor our blood pressure very well. Blood pressure is a silent killer, and you may be going around with high blood pressure without you knowing it, except you go and check. Some people will know for the first time they are hypertensive when they're on the floor with a stroke. You don't want that. And so that's why it's actually very common, among the ethnic group, because we don't check our blood pressure and the blood pressure is just high and damaging the kidneys underneath. So by the time you are getting to know it, your kidney is almost packing up. Your heart is also being overworked already. So before you know it, before you detect, you're already at a very advanced stage. So please, your blood pressure is very, very important. Monitor and keep it under control. Those who are diabetes, they need adequate control of the diabetes, because all these actually affect your kidneys and other organs in the body. So a very good glycemic control of your diabetes is very essential. Now, urinary tract infections, yes, when you have a UTI, you need to treat it, but when it becomes recurrent, that needs to be looked into. Now, I must differentiate in here. There's what we call acute kidney injury, whereby when your kidney is damaged acutely, that will recover over time. But with the CKD, the chances of recovery is quite remote. But for the acute kidney injury, which could be because of UTI, bleeding, or things like that, that will actually recover very nicely. Then we'll talk about adequate hydration, taking enough fluid. People talk about 2 to 3 liters of fluid at least per day, and you need to do that. Lifestyle and adequate exercise and weight management. We cannot expatiate and dwell on this more than enough. You need to have adequate exercise. You need to have adequate weight management pathway. Adequate diet, good balanced diet, very important. Nutritious, good diet, less of salt, please. Otherwise, that's not very good for you. Then we monitor the renal function, like you said, with the blood test that we do regularly, yearly from your doctors. That actually look at your kidneys, and there's a need for it to be done more than that. That is actually catered for under your healthcare management. Now, monitor your renal function, like you said. Then avoiding nephrotoxic medications. Oh, my back aches today. You bump into the chemist, you buy ibuprofen, you're taking 8 ibuprofen a day. That could be very, very risky for your health. Indocid. I know it's not very common around here, but you go home, oh, I've got Indocid, and then you take it, get aspirin, you take it. They could be very nephrotoxic, so be very, very careful. Agbo, if you don't know the component, please be very careful. They could be nephrotoxic as well as hepatotoxic too. And then one of the key managements is renal dialysis. However, it's an expensive, life-changing treatment, and it is not easily available for everybody to use. And so we need to look after our kidney before we get to that level. And before that, after dialysis, the next thing will be, renal replacement, which will be, renal transplants. It's a process, it's a treatment that could be used particularly in younger age group. Yeah, adults will benefit from it, but renal transplant is one of the things that could be beneficial, particularly those who've got genetic problem like polycystic kidney might benefit from renal transplants. And so for us as a member of the ethnic minority group, I think getting involved with organ transplant is not a problem, and it's something that we need to encourage. I will now hand over to my colleague Fatai to put in the butter and the cheese on the bones. Thank you.
Thank you, Doctor. Dr. Fatai.
Good afternoon, gentlemen. Thank you very much, Dr. Adetunji. When you are doing a presentation, you are communicating with non-medical audience, and you've chosen your word carefully. So I commend that. Thank you. So yes, there's nothing else to add, not just to be repeating everything you've highlighted. You've done a very good service to this. I think what I'll do is wait for questions, and let's have an interaction, and I'll try and answer some of the questions alongside you as well. Thank you.
Okay, thank you very much for that. I'll stop sharing now because we do have a few hands raised up already. And okay, I've stopped sharing. I also need to stop recording before we start the sessions.